Well, welcome back, everyone. This is Billy, Harnessing Your Wealth. I want to take a minute to introduce our special guest today, who has been an extremely big influence on my life and the quality of my life after undergoing years and years of chronic pain. And many of you who know me know I've talked about this at length and understand my passion behind it. And maybe you'll know today, after listening to this show, the reason why I'm so passionate about it and why I never stop talking about it. Because if you've gone through any kind of a ordeal like I went through, and many of you have, because pain and chronic pain and things like back pain are an epidemic really in our country and all over the world. And it's so difficult for people to find the true answers and what lies beneath, where it came from. Many are misled to believe that their pain came out of a typical physical problem or manifested from lifting a heavy bag or slipping on the ice or sleeping wrong even. And sometimes they believe it's because it's a genetic factor and they just are doomed from the get-go right at birth. And I know those things have permeated across our mindset through the means of traditional look of medicine and healthcare. But I want to make sure that you guys understand that there's a new approach that's kind of becoming the new way to think, a new way to look at medicine and healing from chronic pain or any kind of chronic condition, really. So we're going to spend a lot of time talking to one of my favorite guys, Dr. David Schechter, here today. He is a renowned doctor. He has his practice out in West Los Angeles and actually had a long story himself that I'm going to have him share with his understanding of pain and how it originates typically, why it comes, why it stays or is sustained, and why it gets worse, sometimes moves around. Oftentimes it affects certain types of people or behavioral patterns in people. And we're going to learn a lot about it today. So this show is Harnessing Your Wealth, but you know that harnessing your health is just as important, if not more important, than the wealth part. So thank you for being on the show, Dr. Schechter.
Thanks for having me.
Yeah, we're so excited because many people that I've talked to in my years since recovering from pain, and it's been quite a few years now, know your name because I've mentioned your name a number of times and all the time to people that I talk to about it. And I've wrote about you in my latest book, From the Starting Gate. And I think that's how we kind of reconnected is I sent you a copy and then you reached out and, said you enjoyed reading my book. And hey, we thought, what a great idea to have you on the show and explain it, because most people don't understand this approach when they have a condition. They run to a traditional doctor, they go have their MRIs, they have, the all the kind of the normal procedures done. And I want to tell the audience a little bit about my story, and then we'll dive into all the things that we're going to learn from you. So this sets the stage up for where we are now. Back in somewhere close to 2000 and I'm going to say 12. I think that's right. 2010, I think it was. I suddenly came down with extreme back pain one morning. I just woke up and I was so stiff and I couldn't get it to go away. Per it was just staying with me that day and I couldn't figure out why. And the more I did to try to think about what was going on and why my back was hurting so badly, I just kept focusing on it, and never thinking that it could have originated from an emotional reaction or my negative feelings at the time, which there were plenty. But I just kept going back to what I had done physically, what I had done. And I settled on the fact that I had been lifting a heavy piece of furniture the day before. Now, I didn't feel any pain during that episode, during that movement, but it came up the next morning. So it was weird. It's like just came about. We didn't have a lot of explanation, and then it stayed. But it didn't just stay. It got worse, and it got worse, and it got worse. And So a few weeks go by and I call up a chiropractor and I think maybe they can help me. And I go to a chiropractor and then they put me on a 6 month protocol and they're going to fix me. And
mm,
they don't fix me. And I go to a physical therapist and the same thing, they don't fix me. So then I go to a spinal surgeon and of course order my first round of MRIs and they find little things, everyone had a different assessment, a different prognosis of what was wrong and how they were going to cure, how they were going to help me, or maybe just take my time, back off. Oh, you're a runner? Yeah, that's probably a big problem right there. You need to stop all kinds of physical activity, no more lifting weights. And so the more I went along, the more I became nervous to do things and nervous to live my life the way I wanted to. But the pain was, it just got worse and worse and worse. And then finally, years later, now this pain never went away on me. But I'm fast forwarding interest of time. I had seen a minimum of 30 different specialists for whatever I could come up with, from nerve pain to was it something with my digestive tract? I had my gallbladder removed. I would have done anything.
mm,
I would have done anything anyone would have told me. And these doctors just do it. I'm not trying to bash on doctors, but my experience with that showed me that I was going down the wrong path because I was not getting better. I was just making things worse. And then finally, I had
yeah,
a rheumatologist just diagnose me with a disease known as ankylosing spondylitis.
mm,
And that was a scary moment. However, at the time, I I said to myself, finally, now I know what's going on. Now I finally have the answer. So I have this disease. And she said, yeah, it's incurable, but good thing is we have these drugs that you can start taking immediately and should give you a little bit of symptom, relief. So started with these weekly injections, taking these shots, and I felt like this is my life. This is the way it's going to end up for me. Of course, it start looking and doing my research now on the internet, and then I'm led into the world of Facebook and all the groups that are associated with this disease. It's an autoimmune disease. So then I joined a group of ankylosing spondylitis sufferers, and then my symptoms they worsen dramatically because I'm reading people in this group of all their different symptoms, how things got worse, the things that started coming around for them, uh, nerve issues, couldn't hold things, started to stumble, couldn't walk in a straight
mm,
line. All these things started to happen to me just magically after reading about them. Now they're coming home to roost. So, long story short, this is my diagnosis. I go another year and a half, and my wife stumbles across a book that was written by Dr. John Sarno and get me thinking about maybe there is a different path. Maybe that isn't the diagnosis. Maybe I'm going the wrong way. And I start doing my own research again in that realm of what's called TMS, tension myoneural syndrome. And I came across a website called TMS Wiki, and that's on the internet, still functioning today. But I looked for practitioners. The more I read about it, the more I wanted to learn about it. And I looked for practitioners in my area, not a single one in Utah. And I found Dr. Schechter, who's in California, basically the closest to me.
mm,
And I booked the appointment. This was a major, so I'm just setting the stage for people to understand. This is not like the traditional route of, okay, I'm going to continue taking these shots. I actually wanted to learn. I wanted to believe that there was a different option, that my life wasn't going to be over and suffering. And that's when I booked my appointment with Dr. Schechter. So that lays the background for me. And now I'm going to ask Dr. Schechter, and we'll kind of go through my story of how I healed, because I'm 100% better. And it wasn't just a few weeks after meeting you out there at your clinic that I was cured. After 7 years of
mm,
debilitating pain that was chronic and suffering. Um, and then I've read your website, and so many people have similar stories, and um, just amazing what's happening and what can happen. So, how about your background and how you came into this field of knowledge? You want to tell us a little bit about that?
Sure. I mean, I was a medical student at New York University, about 21 years old, and I was playing a lot of basketball and running, and those were my big stress relievers from medical school. I had played quite a bit of basketball in college, and unlike you, who favors the smaller sports, I'm taller, so the sports where you can jump and reach are better for me. But I started to have knee pain, and I went through the student health, and I was referred to an orthopedic doctor, and they couldn't really find a clear cause for my knee pain, and no clear diagnosis was made, and my knees kept hurting. So I started to worry about it more because I wanted to get back to these activities. So I walked into the office of a doctor who was a rehabilitation medicine specialist who had lectured to us in anatomy, and his name was John Sarno. And at that point, he was not known yet as the mind body medicine guru doctor. He was a rehabilitation specialist. He was seeing people with back pain and other conditions, but he had started to formulate these theories. So when I went in to ask him for advice or physical therapy or something, he said, "Well, I don't know how you'll take this, son," because I was pretty young, so he could call me son. But 95% of chronic pain is psychosomatic, which meant that it was more brain and mind and emotion based than it was physically based. And obviously, I was shocked to hear that from him. And he could see I was a little bit skeptical, a little bit shocked. And he said, "Well, come to a seminar that I give my patients. And the seminar is part of the educational program, but you can come for free and check it out. And I'd be glad to see you as a courtesy to a medical student, see you as a patient if you believe this might, be interest you and be the diagnosis." So I decided to go to the seminar. There's a bunch of well-dressed Upper East Side, Upper West Side New Yorkers at the seminar, and 21-year-old me, medical student in corduroy pants and a plaid shirt, and
Mhm.
whatever other clothing I had that day to go to the seminar. And what he said in the presentation just made so much sense to me in terms of being a worrier, in terms of being under the stress I was under as a medical student, in terms of not enjoying the first year of medical school, which is a very dry year, a lot of lectures and things. It doesn't involve patient interaction so much as the other years do. And he really laid out this whole scheme of how the brain can create this pain and perpetuate this pain, and it made a lot of sense to me. So I spoke to him after the conference and said I would love to be examined by him and confirm the diagnosis. But I went home that night and sat on my bed in my little tiny subletted apartment, looking out at a brick wall in Manhattan, all I could afford, and I felt the weight was lifting off of me. Right, so the weight was like the pressure I had been put on myself and that I had felt from having this pain, from not being able to run, from not being able to play basketball, and from not being able to get an answer. And I felt like maybe I had an answer. So I went to see him as a patient a week or two later, and I went to a couple of other seminars that he was doing at that time for his patients. And he confirmed the diagnosis with the examination that he made of my knee and also certain tender points on the back that can be helpful. And then there was no books written yet. There were no internet. There was no videos. This was in the 80s. And but what he taught me in the seminar and what I learned from talking to him was enough that I could change my mindset. I could change my attitude and my belief. And those were the two key things that I could change without, there were no books or videos to study at that point. And lo and behold, I started walking with a little more jump in my step, and I tried jogging a little bit, and I'm back to a little bit of running, and I'm shooting free throws. And this is all happening over the course of a few weeks or a month. And I'm amazed at this because, again, there was no physical treatment, there was no injection, there was no
Mm.
structural transformation. And yet, changing my mind was changing my brain, was changing my nervous system, was changing my body's reaction to sensations in my knee. There was nothing structurally wrong with my knee, and the pain went away. But it was real pain. I can tell you it
Right.
hurt, just like Billy and everyone else I see with pain. It's real pain. It's just that the way to get rid of it is not by working on the individual area that hurts, but by working on the most powerful organ we have in our body, which is our brain,
Oh, yeah.
and that controls the nervous system and all of that. So that's how I got into this work. The following summer, I got a small research grant from the school, and I was able to spend the whole summer in Dr. Sarno's auxiliary office, and I was calling up prior patients to do a little research study, and I was hearing the same amazing stories that I'm telling you and that Billy's telling you over and over again from people that he had treated over the previous few years. And we compiled that data into a little bit of a study that he published in his books rather than a medical journal. And I also got to see patients with him throughout the week. Whenever he was seeing patients, I'd put on a white coat and see them with him. So I learned a lot from him that summer. And the rest of the medical school and medical doctors there were skeptical when I told them this amazing experience I had. They scoffed at it. You know, they said, "Oh, maybe it just worked for you because
Yeah.
whatever." Or they said maybe those he selects certain patients that it's
Mm.
going to work for. And I said, well, everybody selects patients. I mean, you don't operate on a hernia if somebody doesn't have a hernia. I mean, he selects people with tension myoneural syndrome,
Yeah.
TMS, and it's got other names now, but and then he treats them effectively and they get better. So isn't that an amazing thing? And again, there just wasn't that much interest in the 80s at NYU Medical School about that. But that was the beginning of my journey toward becoming a doctor that incorporates this into his work every day of my practice.
Mm. And thank God for you and for you choosing that path because I don't know if I'd be where I am today without you doing that. So I just want to extend again my heartfelt gratitude for you being the person that you are. You've written a book called Think Away Your Pain. You have a workbook called Mind Body Workbook, which helps people analyze or kind of take a note or a diary of what they're doing in their life and how to kind of go back and connect the dots to what's triggering it, maybe how to slow down and think differently about your pain. And then you have a DVD, which is very helpful. And you put these things out there many years ago, and I can't imagine how many people have benefited. We're starting to see more and more of this type of thing in the mind body realm. A lot of books being written and potential new resources coming out from different people that understand it. And I think that that comes with getting your own, having your own personal experience. And maybe that's why a lot of these doctors that you worked with or maybe continue to work with scoff at it and laugh at it and think it's kind of quackery in the fact that they've never experienced it themselves. Do you think
Yeah,
that's possible?
having that personal experience is very powerful, and many of the people who went into the field like I did had a personal experience either with Dr. Sarno or one of his books or one of my books or something of that sort. You know, the story you said before, Billy, about seeing 30 doctors is not at all uncommon. It's quite common, right? You could keep seeing people, specialists, better and better, well-known people, and they don't help somebody. And the reason is because they're asking the same questions and they're looking at the problem in the same way. And what I learned from Dr. Sarno is to look at the problem in a different way. It's actually to treat the patient, get to know the patient rather than just the back or the knee or the headache. And that's really the important part. And the workbook that I wrote, the Mind Body Workbook, is a form of expressive writing. It gets people to write about their feelings and focus on their emotions rather than just their area of pain. And that turns out to be very effective. Sarno would say to me that education is sort of the penicillin for this disorder. And it's true that educating people about what is really wrong with them and how they can get better, or the fact that very little is wrong with them structurally, is part of the process. And for many people, some degree of psychological introspection is also part of the process. And it varies whether that would be just with the office visit with me or a doctor, or whether it would involve the writing, like the journaling and the workbook, or whether it might involve referral to a specialized psychotherapist or psychologist in the field. It just depends on what the individual person needs. And as you said, we have a lot more resources than we used to. There have been a
Mm-hmm.
couple of movies made about this now in the last few years.
Mm-hmm.
So that's kind of exciting.
The one I
Um,
remember is the Heal documentary, which was, I don't know if you saw that, but uh, it was a very powerful movie with a lot of different people, actual patients who recovered or have started to recover. But then also there was one on Dr. Sarno's work.
one of Dr. Sarno, All the Rage.
Yeah.
and I make a cameo appearance in there, and so do a couple of his former patients, Howard Stern and Larry David. Kind of famous people who have come out and said, "Yes, Sarno helped me. Sarno cured me."
Mm-hmm.
And so they're in make brief cameos in the movie, all the rage, and it can be streamed by anyone who's listening or wants to learn more about it.
Mm-hmm.
A lot more resources. I've done an online course called the Mind Body Healing Journey, which is a video course with a psychologist, so people can really spend a few hours watching that course. The books are now on Audible as well as ebook and regular books, so there's a lot of ways to access that information. There's websites like mine and others,
Yeah.
and the field has definitely expanded. So it's not all bad news. I mean, there's still a lack of acceptance by large parts of the medical and alternative professions. On the other hand, some of my colleagues have published some research studies in the last few years, which have begun to add to the credible evidence that we have. One of the criticisms of the earlier work was that we built a beautiful house, but we didn't have the foundation, the foundation being the medical research. Sarno was not primarily a researcher. He was a physician, clinician, and theoretician, but he was not a researcher. So in the current world, research is very important, and data. And so we're starting to create that. Some of my colleagues have been very involved with that. I did a study about 15 years ago, and others have done it more recently. So that's another step forward in the field. And so I'm encouraged by that, and people are more open to it than they were years ago, and that's also important, because if you're not receptive to this, sometimes desperation leads to a willingness to be open, right? And that's
Mm-hmm.
unfortunate, but true. But other times people will notice certain things about their pain, certain patterns. It doesn't quite fit, or it always happens at 5 o'clock, or it always happens when I wake up. And they start saying, wait a second, maybe this is not just due to a structural or biochemical process. Maybe I need to look at this in a different way. And
Mm-hmm.
that's the realization eventually you came to, and I came to when I met Sarno. So those are different factors that might lead people to looking into this more. And we can talk about other diagnostic things that we do.
There's so much that came out of my experience, and I'm grateful for it, to be honest with you now, because it taught me and my family. My family had watched me go through it, and now we have changed our thinking and our mindset 180 degrees on when anybody in my family has some kind of a condition, or they're feeling something, a physical sensation somewhere. They first think emotionally. What is going on in my mind? What am I worrying about? And it's so gratifying to see my kids who understand that now. My wife is actually a mind body coach. She got into that field after going through that with me, and she was right by my side the whole time, uh, basically suffering with me. I was a shadow of myself. I couldn't function. Getting to the point where I was thinking about ending it all. I did not
Mm,
have any quality of life. I couldn't participate with my kids. I couldn't enjoy going and watching them play sports. I couldn't do the things I wanted to do. I mean, I remember being like trying to go golf, and I'd physically have to lay down on the grass, lay down on my back. While everybody else is having fun and golf, and I'm laying off to the side, uh, or going to some sort of performance with my kids and sitting like on bleachers was agonizing. I was in such pain doing that, just couldn't sit there with my back the way it was, and had to have some kind of support or lay down. I took my boys to Alaska. I wanted to do these things. I wanted to be a good dad, and I took them to Alaska to go fishing on a fishing trip. They were at the perfect age to do it, I felt. And I remember in the rental car driving out to where we were going to our lodge at Soldotna. I had to stop an hour into the drive, pull over, and lay down in the car in the back seat
mm,
because I was in such pain I couldn't continue to drive. The boys are out, running by the river, and I mean, it's such a terrible condition. So it always felt like stabbing knives, or, sometimes it was on fire. Sometimes it felt like just radiating pain, or it's hard to describe, but the nerves and what I was going through, and then a constant focus on it. You could never get your
yeah,
mind
yeah.
free from it. You were just so enamored in what the pain was doing. What is it changing? What's the severity? Is it a 10 or is it a 9? And oh, I've got this event coming up. How am I going to get through this? And then the pain would get worse. Traveling or trying to meet with clients or trying to be on the phone and just trying to fake your way through the day. And I just felt like my life was pretty much wrapped up, and I had no choice to get out until I found this work. And it's just amazing to me now how mainstream medicine misses it. And why they don't, why mainstream medicine or even the insurance companies or the medical schools, why they don't look at this. Why isn't this the foundation of what they teach when you just mentioned treat the whole body? Because doctors, from my experience, they treat the body as if it's separate from the mind, and they treat it as if it's a machine that breaks down and needs to be repaired. How come?
Well, Western medicine has been very successful. First of all, I want to just say what you shared is very scary and just shows the importance of this work. I mean, you were really in a bad place, and I'm glad really your whole family and you were transformed by this diagnosis and approach. But I would say that Western medicine has been very successful at the treatment of very severely acutely ill patients. There's no other form of medicine that's better for leukemia, or that's better for a major trauma with bleeding. I mean, other cultures don't have that type of medical approach that can save that type of patient. But the problem is, as we've become necessarily mechanistic to help a small percentage of people who desperately need a treatment for a very, very severe medical condition, we've kind of lost the essence of medicine, which is listening to the patient, listening to the history, understanding what they're going through, understanding where they're coming from, emotions, all of that stuff that maybe the doctors 100 years ago and in other cultures knew or know. And I want to point out to your listeners, and pretty much any physical symptom you can have as a result of an illness or disease can also be produced by the mind or emotions. So let me give you three examples that I think are helpful for people. One is, you can have diarrhea because you traveled somewhere and got a parasite or an infection or a stomach flu or a flu. But you can also get diarrhea because you're nervous about an exam or a performance or a date or something like that. I mean, the same diarrhea, right? You get the runs. Okay.
Mm-hmm.
Sorry to be so descriptive, but
Yeah,
it's important to understand that.
it's
You can
good.
you can get headaches because you played basketball and somebody elbowed you in the head, or you were a jockey and you fell onto your helmet, or you can get headaches because you went onto a 2x4 as you stood up in a construction location. But you can also get headaches because you're stressed. You can get headaches because you're tense. You can get headaches because your money situation is not good, right? And those are all psychological and emotional factors. And the headache feels exactly the same. You can get chest pain because of angina, which is a lack of blood flow to the heart. It's very serious, and it happens typically to men and sometimes women over the age of 50 and over the age of 60, sometimes a little bit younger. Squeezing chest pain, right? I mean, it's like get a heart attack from that, but it's angina. And on the other hand, you can get squeezing chest pain from a panic attack. You can get squeezing chest pain from anxiety. You can get squeezing chest pain from nervousness. And it feels exactly the same. And I'll tell you that 40% of the people who show up in the emergency room with chest pain, and they usually skew younger, they may skew a little bit more women than men, but they don't find anything. It's just stress and anxiety. The doctor will tell them, there's nothing wrong with you. You're fine. Go home. They may not explore the emotional, but they know that there's nothing related to their heart. So all of these three examples, and I could come up with another 10 if I wanted to, are the incredible power of the mind, brain, and emotions to produce symptoms that feel exactly to the patient like if it was a physical damage or disease.
Mm-hmm.
But
Mm-hmm.
you realize at some point as a physician, and you realize as Billy did as a patient, that you've tried the treatments for the physical condition, and it wasn't helping you. I was trying things for my knee, it wasn't helping me. So you move on to looking at other options, or at least being open to other options. And that's what we really need from patients, is to be open to it. And then, of course, from doctors, we need other things. But in terms of patients, we need that openness. If you're open and are willing to look at this, you may find a solution to your problems. And
Yeah,
that's very exciting in my work. I just all I need is people to meet me part of the way. You know, if they're completely closed, you really can't help them with it.
that's a great point. I remember needing and being at the mercy, oftentimes, of doctors who helped me after or during an acute injury. During my writing career, I had a number of them. Obviously,
Yeah,
the broken bones and scary times was hauled in an ambulance to the emergency room. You know, those acute injuries, you are very grateful for expert doctors who know how to help you and repair a bone, you know, fix a, I broke my femur, snapped it in half, and had many injuries to my legs and some one time knocked my teeth all out. I had to have those repaired, just a number of other things. But when when things become chronic, this was my
yeah,
first experience with
yeah.
pain that just wouldn't go away. I mean, I was always just more of an athlete that you heal from these things. You give it rest, you give it time, you follow this protocol, you know, do what the doctor says, but the pain's not going away. The pain's just staying there and it's not getting better. And that's when you don't know what's going on. And that's when I think this approach is the absolute answer is the emotional, the psychosomatic, the psychological view of what's going on. And you asked me that when I was at your office is something no one had asked me in the 7 years of my desperate search.
Mm,
You said, what was going on in your life about the time this pain started?
mm,
And I had to sit back. I had to sit back and what are you getting at? What do you mean? Because that never occurred to me really. I mean, I had read the Sarno books and I kind of I wanted to understand, but I didn't understand. That's when it clicked. Is seeing you and having your conviction there because you know, we're trained to believe the doctor in the white coat. We're trained to trust and believe everything they say. So that's why it was so difficult for me to go away from what I'd been told that I have this disease. I have a disease because I have a blood marker that says
mm,
this is your disease. That's the scary part for me and so many millions of other people out there who are labeled with a disease. And I like to use the term dis-ease because
mm.
it's really more about your your mindset and something that's not at ease in your mind and you're not balanced and you're not comfortable with what's going on in your life. And so you have this hyperactive system of tension and worry and anxiousness, whatever it might be. And that became my natural state of being. So I didn't even realize it. But for many years, the pot's boiling, 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 and it finally just had to blow over. And that's where the pain will come out. And Sarno mentions it comes out in the place that it's the easiest to believe. You know, maybe something that you're doing, like you playing basketball a lot, so your knee is just coming out in your knee. I don't know. I think a lot of new doctors are looking at this in different angles and coming up with their own theories, but it all still goes back to the emotional component of the mind. The mind produces it. The mind can get you out of it. That's what I find is most powerful that
Well,
people miss.
you've shared a lot of wisdom there. I mean, that key question that I've asked thousands of times to people, what was going on in your life or what is going on in your life? I mean, that's a question that they say to me. I saw 20 doctors, nobody ever asked me that. So that's clearly needs to be taught. And I do teach it to the medical students and residents who occasionally come by my office to learn that key question and that key approach. The other thing you mentioned is you had a bunch of fractures and things as a jockey,
Mm-hmm.
but they healed. You
Mm-hmm.
break a bone, it heals in wrist heals in 3 weeks. Leg might take 6 or 8 weeks or even a little bit longer, but the bones heal and you're able to go back to your activity. So why does pain become chronic? People come to me with a backache for 20 years, but they broke a bone and healed in 6 weeks or 4 weeks. Doesn't seem to make sense, right? Because what happens is initially there might be an injury. Maybe you pull something in the back. Sometimes there isn't any injury and it's just muscle tightness from stress. But let's say you do pull something in the back, but then you start worrying about it. It starts getting to a different cycle. So there's been research that shows that acute pain is experienced in a different part of the brain. This is based on functional MRI imaging of the brain, which is a special type of imaging. It's different than the regular MRI you get. It shows the blood flow in the brain. So acute pain is experienced in one part of the brain where you'd expect it to be, the somatosensory cortex. But chronic pain, pain lasting more than 3 to 6 months, is experienced in a different part of the brain. Prefrontal cortex, amygdala, etc. These are areas closer to the emotional centers of the brain. So the science over the last 20 years has started to demonstrate what Sarno had hypothesized, which is that chronic pain is different than acute pain. And we shouldn't be treating it the same way. And we shouldn't be looking at it the same way because chronic pain is more connected to the emotional centers and to how we're feeling about ourselves and the world and other things in our lives. And so that's what we need to be dealing with chronic pain. So that's why something like physical therapy is really good if you had an acute injury, and I prescribe it and I advise it and I've used it myself. But if you've got chronic pain, you don't go back to the same treatment over and over again and expect a different result because people say that's the definition of insanity to keep doing the
Mm.
same thing over and over again, expect a different result. So we have to be doing something different, and we do have something different, and that's this approach to a new word we use is neuroplastic symptoms or neuroplastic pain. You may have heard the term neuroplasticity, referring to the fact that the brain at any age can go through rewiring and changes. And so some of the doctors have started to use the term neuroplasticity or neuroplastic symptoms or pain to update the term TMS, which was the acronym that Sarno first developed for tension myoneural syndrome. And there have been other names for this too. Um, and we don't have the perfect name because having a good name is important to explain to the public and to explain to doctors and scientists. And so we're sort of using this term neuroplastic a lot lately, and I think it is probably a better term. Dr. Sarno said to me himself when he was alive that he wished he had come up with another name. He didn't really love the name. It was originally tension myositis and then tension myoneural. And those words don't exactly mean the same thing to patients that he wanted to say, and it's kind of confusing. So what this is it's a kind of brain pain. It's brain body pain, and it's real pain. It's not imaginary. You're not faking it. You're not malingering. You're not imagining. It can be debilitating pain, as Billy describes, with lying down in the back seat of the car or on the grass playing golf. It can be real debilitating pain. And yet, when we start unroofing it and when we start understanding it and we start going to the brain and the mind and changing attitude and belief, it does start fading away, sometimes quickly, sometimes takes longer, but it can go away completely in the vast majority of people who really take this seriously.
That's so powerful. And it's not just back pain, right? It's like you said, knee pain and all kinds of joint pain. And there's your pain in your with the headaches. A lot of people have chronic headaches. I've known people with that. They wake up and they have a headache, and it's like a miserable day for them every day of their lives. But back pain, I think, has most of the attention because it's such a huge industry and there's
Yeah.
so many people affected by it. Yet I read a study, and I know there's various views of what works and what doesn't work, but I read a study and somebody reported that up to 70% of back surgeries don't cure the pain that they went in for. Now, I think that's alarming, and I know that some of these surgeons are there performing, I don't know, up to 5 to 10 surgeries a day, possibly, and they're doing things that aren't known to be helpful. Like, I think it's weird how the industry continues to operate under this premise that that's the only way to go, and doing spinal fusions and things like that that just seriously limit what a person can do after the surgery is completed. I don't know. I just think that this is overlooked. I think that we need to get more information out there. There's so many negative consequences, and I know people who I've tried to lead into this path, into this awakening, I'll call it, but they want to attach to their condition, and
Mm.
they've been told that they have spinal stenosis or whatever. You know all the terms, all the back
Yeah.
terms and everything, but they have this, and the doctor told them. And I could have done the same thing, and I kind of did for a minute, where my wife was telling me, "Look, this is what's wrong with you. This is Dr. Schechter," and he got me your book, and got me, after I found you on the website, she got me your book. I started looking at that. She said, "This is what's wrong." I said, "Heather, I was diagnosed with an autoimmune disease.
Yeah.
How am I supposed to overcome that? That they told me I have this." That's the hard part, I think, for a lot of people is moving past
Yeah.
the label.
I mean, I try to do a very careful evaluation. You know, I don't assume that everybody has this condition. I mean, I review their imaging with them. I review their lab tests if appropriate with them. And I often find that people are misdiagnosed. You know, there's people with uh, back MRIs, and when I review them and I say, this is no different than the average 50-year-old or the average 60-year-old. This is not something severe. Now, there are, you know, there's, to be truthful, there's a small number of people who do benefit from back surgery. There's too much back surgery being done, but there's some people with very specific indications who do benefit from it. On the other hand, there's a tremendous number of people who benefit from this who might be able to completely avoid a back surgery. As far as autoimmune conditions go, the problem with, you know, ankylosing spondylitis, for example, is that there's a marker that is identified with people who have that condition. But you can have the marker and not have the condition, right? And so people see that marker and they immediately go ankylosing spondylitis, but it doesn't necessarily prove you have the condition. The other thing is, even with autoimmune conditions, emotions play a huge role. Although I think primarily we work on you know, non-specific back pain rather than autoimmune type of conditions. The other thing that you pointed out was there's a lot of types of pain that we are able to help, and the list is getting longer and longer. I mean, starting from the head, you know, headaches, migraine and tension headaches, neck pain, very commonly help people with neck pain, arm pain, overuse syndromes. You know, a lot of those just go away when you start looking psychologically. I was seeing a lot of those in the mid 90s when computer and internet was taking off. Um, Pelvic pain is a very common problem in men and women that we are able to help with this approach in many cases. And even many pelvic physical therapists acknowledge an emotional link for their patients with pelvic pain. So we're able to help people with arm pain, pelvic pain, some people with plantar fasciitis, which is a foot condition. Some people with carpal tunnel really don't have a structural problem and they can benefit from this. Many tendonitis patients. Again, when you start off, they may have an injury, but then they start thinking about it too much and obsessing, and you develop pathways that need to be eliminated because they're no longer playing a role for you. So there's lots of conditions that we can treat. There's lots of surgery that we can avoid. And on the other hand, there's still a need for surgery for certain types of things. But sometimes it's very limited surgery. As you said, fusion doesn't have great results in most people. I mean, it's like a 50-50 or less. And that you don't want to get your back cut open and permanently altered for a 50-50 chance at something. So
Right.
try all the conservative approaches first and definitely try to be open to a mind body approach. It's not, I mean, it doesn't involve medication. It's non-invasive. It's not dangerous. It just requires some effort on the patient's part and guidance by the practitioner or doctor. One of the things about this approach is, you know, people with chronic pain feel like they're victims and feel like there's no answer, right? And so we try to take you from a victim to a participant in your recovery. And I think
Hmm.
that's a very important part of this whole program is to start changing your belief system and then get you to participate in this, right? You're journaling, you're reading a book, you're watching a movie, watching a video, you're starting to walk every day. I have people who say to me, I can't walk 3 blocks. So I say, you know what, tomorrow you walk 1 block. The next day do two. The day after that do three. And then the day after that do four. And every day you're gonna add a block. And it's amazing, but they come back in a month and they're doing 3 miles. And so it's just about, you know, finding out where they are and helping them to build it up.
Building, yep, starting somewhere and building.
Slowly. Start somewhere and move
Yeah,
slowly.
I think the movement part is huge because people realize that hey, they can actually do the physical things that they've been told they couldn't do, and that gives them a huge boost of confidence in maybe changing their mindset and believing something that might have been unbelievable to them before. You know, there's something I wrote about in my book was interesting for me in the placebo effect of medicine or mind, and again shows the power of the mind in these studies. But there was a doctor named Bruce Mosley who did a study on knee pain patients who had chronic knee pain, and so he felt like, hey, well, we're making we're making these patients get better by what we're doing. So he wanted to find out what part of the procedure of his knee surgeries was the actual most important. And he divided them up into three groups. And he had the first group where he just shaved some cartilage off the knee. The second group where he more or less flushed the the joint out of any potential loose debris. And then the third group was a sham surgery where he just cut the knee open and then sewed it back up and then gave them all the same recovery protocol. No one knew what surgery they had. And amazingly, they found that the placebo group, the sham surgery group, had the same rate of recovery as anyone else in that study. So he concluded that his expertise as a surgeon had no benefit whatsoever on these patients, which is interesting because some people would fall back to the idea, well, yeah, but the people that got the surgery, the actual surgery, got better. But here's my question, go deeper. What if it was just the belief that was the key all along? Whether they got a surgery or just believed that they got, what if we did all of those as a sham uh, and had the same rate of recovery? So what I'm suggesting is there's the mind is the key, the mind and the belief. And I say that my recovery wouldn't have been possible if I had not believed. And it took me a minute because again, I had to come out of the hole that I was in. I was in the hole of being diagnosed with an incurable disease. And I feel so bad for so many people who are in those same conditions that they shouldn't be. And there's a guy that does a podcast, right? He still does it, I believe. And he also was diagnosed with ankylosing spondylitis, AS. And he does a podcast where he says that all AS is TMS. He says that none of it is a legit. He basically says it's a label. They didn't know what was what to term it. So the medical community just sticks it with this is your symptom, and now you have a label, and now it's incurable because we don't know how to cure it, but we do have drugs that we can treat your symptoms every day. So he has a huge following. And matter of fact, I was on his podcast a couple of times, and I've had people all over the world who have called or emailed me about how I got better and my path to it. And I just keep going back to this whole emotional sense of what going on in your life and how you can stop and just let go. And I heard that so many times in my early years of reading Sarno, just let go, let it go. And I thought, I'm pissed off at hearing that. I don't know what that means. And people get mad because they think we're saying it's just in your head. And we're not saying that. We know the pain is serious. And I've been through it. So I know this is hard. This is a hard thing to accept. And it's a hard thing to maybe move away from what you think is like the safety net of the traditional medicine or the uh, if you're on the painkillers, I hope that you'll open your eyes to this possibility because the opioids are addictive and so many people are facing a lifetime of that and just losing the sense of who they really are. But I had a therapist, with your approach. First of all, what gave me the power to get better was you not mincing any words, you not going back and forth and wavering and maybe this and maybe that, but maybe we'll have to see how you do because you could really have this AS disease. That wouldn't have helped me at all. Obviously, it was the belief, it was the power of your delivery, and you telling me this is what I have, you checking me out, you checking these pressure points in my back and my hips, and thoroughly reviewing my MRIs, and then prescribing a therapist for me, just somebody who I could talk to, somebody who could help me dig into the stuff that I was going through, which was immense, and I just buried it. That was my way to handle everything is just to bury it and not think about it. And I felt like that was the best approach because then I wouldn't have to worry about it. But little did I know the subconscious mind is holding on to all of that. And it was coming out in nasty ways because I never let it process. I never got it out of my system.
Well, you mentioned so many important points. I mean, the surgery study, which was the sham surgery versus arthroscopy for what's called degenerative knee disease or arthritic knee disease. I mean, that's a powerful study that is well known. Um, and surgery is the ultimate placebo. I think John Sarno might have said that many years ago, which is true. I mean, it's more powerful than a pill. You mentioned the word placebo in general, placebo being a statement or a belief that helps you to heal, even if it is not an active ingredient, so to speak. But there's also something called nocebo, which is the opposite. So a lot of my patients are getting nocebo comments from physicians or practitioners, and I have to deprogram them. I become almost like a deprogrammer of a cult. And they come in and say, well, but the doctor said this. And I go, it's not factually correct. And here's why. And I have to really talk them down from that. So that's called a nocebo. People haven't, not everybody's heard that word, but that's the opposite of placebo. And then you also mentioned, movement and how important it is. I think this is such an underrated part of the recovery because this is a psychological educational program, but getting people moving is an important part of what I do. And, again, I know you're a father of some children, as am I, but I saw a man who was had a 17-year-old son, and he said, my son has never seen me run. And I said, you mean like run a race? He goes, no, not even like run 20 steps because I've had back pain for 20 years. And he grew up, and I always said to him, I can't run. So he went through this program, and literally a month later, he comes back with tears in his eyes, and he said, my son and I went for a jog together, and I
Mm,
can't keep up with him because he's 17, but it was so exciting to him to just go for a run with his son. Imagine that
mm,
after 17
yeah.
years. So movement is very important. We started slowly. I didn't have him go out there and run 5 miles. I just had him start walking briskly and then break into a jog for 30 seconds, and walk briskly and then break into a jog for another 30 seconds. And, that's just how it starts. And then the psychology, the fact that we have qualified and interested and skilled psychotherapists, not only in California, but other states. We now have TMS coaches as well, who are they're not therapists, but they also listen. They also help you heal. So there's lots of practitioners out there now in my community, and that I can refer you to, and then also that you can find and work with, and we worked collaboratively together. So it's great now that we have more people to help you. And
Right.
yeah, that's just, you said so many powerful things. I wanted to just comment on a few of those.
They're huge. I see it firsthand now. As I mentioned, my wife Heather, who has moved into this and has her own business called Pain Free for Good. She saw the power in my healing, and she has this special talent where she connects with people and can help them see things differently. And she just wanted to give back that because she knows what we went through as a family, and she's helped dozens of people, and she's had people from Australia and from England and from different parts of the world, Spain, who have contacted her, and she's helped. She had one person that was bound to a wheelchair for
Mm.
7 years and hadn't walked, and now sends videos to her up walking and traveling and walking the beach, and just by this same approach. She's become a mind body coach. She's done a lot of studying, become certified in that, and understands. And she believes truly that for every physical condition, there's an emotional root cause, and she kind of links it back to what that root cause would be and what would be the underlying emotional triggers for that. And so she has a way of just helping people process those things. And obviously we're not talking about the acute injuries. The acute injuries are significant sometimes and severe and need medical attention, but we're talking about the conditions that can be anything, really. It could be people with the, um, and I hate to keep going into things that people maybe scoff at, but I even had a diagnosis of gluten intolerance at one time. You have this, you can't eat these foods. My daughter was given a diagnosis from somebody that was examining her for headaches. She was getting these headaches constantly when she was younger. And this was after my understanding came to realization. This was maybe a year after I had met with you and I had recovered. And then my youngest daughter, my at the time playing baseball, playing with the boys, and she was only 7, and she'd go out for every game, and sometime magically she would end up with a massive migraine headache, and then she would be throwing up, and we didn't equate it to the game at the time. We just thought, well, it's just something that's happening, and we don't have any connection of why, uh, until I went through your program. This had been going on for a couple years for her, and then we started to say, wait a minute, what's the emotional situation that she's dealing with? Oh, it's the pressure and the stress of her playing in the game and performing. And she's so worried about doing well that she's making herself physically sick and ill. And once we kind of got through that, she learned how to just relax, and then she's been able to manage and not have those things ever since. And our whole family has had these experiences. That's why I think it's so important. If you go through it, it changes your life. You'll never be the same again.
Yeah.
It's
That's great. That's fantastic. Heather and I need to speak at some point, so I could potentially refer her some people
I think so.
in your
Yeah,
state and elsewhere. And yeah, she and I should have a talk offline sometime.
we should. You know,
Yeah.
we think so much about you. We named a racehorse after you, so that's a big step.
Well, what's the name of the
His name
racehorse?
is Dr. Schechter.
Oh, really?
He ran out in California. Yeah,
Is he still running?
he's not there anymore. He's out in Texas now.
I got to get a picture. I have to have a picture of a
I'll
horse
send you a
named after
picture.
him.
Yeah, because he won a
Yeah.
race out there, and I'll send you a picture. You can put it up on your wall there.
Yeah, I'd appreciate that. People say,
Yeah.
you didn't name your
Most
child after me, but you named your horse after me. So that's pretty good.
yeah, the horse is actually more important than the child.
Yeah.
So
Well,
no, it
children were
was
already
amazing.
born. Yeah.
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 A couple more questions I just want to get into, and then
Yeah.
we'll wrap it up. But what do you think needs to change in the healthcare industry to allow this approach to gain more traction?
Well, the challenge is the doctors, especially in primary care, are rushing faster and faster. They're being told, see somebody in 15 minutes, see somebody in 12 minutes, see somebody in 8 minutes. And you really need a little bit of time to do this work right. So I set up a 45-minute initial consultation to sit and talk to people, right? To examine them, to review their history. So there has to be a change in reimbursement, so to speak, so that physicians have the time to do what's called
Hmm.
cognitive work, thinking work, talking to people, not just get paid for procedures. So that would
Hmm.
be a global type thing if any of your listeners are involved at the global level.
Does that mean insurance, the way
Yeah, it would mean
payments are made?
insurance, Medicare, though, the whole system should reimburse doctors differently. The other thing would be, at medical schools, maybe patients can pressure medical schools to start teaching this. I mean, for years, medical schools didn't teach nutrition at all. Now they're teaching a little bit of nutrition, and they should be teaching psychophysiological medicine or neuroplastic symptoms, like we're talking about. They should be teaching that. I mean, it wouldn't take that much to do that. So that's another important thing. Get the doctors when they're young. You had mentioned teenagers before. I've developed a program for teenagers. I'd like to get it in the schools.
Mm.
I'd like to have middle schools and high schools during health education teach their teenagers about how the brain affects the body. And I've got a little curriculum I've developed for that with a teacher and a psychologist. If you get the younger people exposed to this, then when they get into their 20s, they get into their 30s, they'll be more aware of this, and they can kind of maybe push the doctors a little bit to look at this as well. So it's kind of a global issue to make our society healthier is going to involve doctors, it's going to involve psychologists, it's going to involve the insurance system, um, and maybe go back to the educational system that we have both in medical school and even for middle school and high school students. So I've thought about it over the years. It's a challenging problem, but we need to start somewhere.
But I think the biggest part, as you mentioned, alluded to, is the money part. The money
Mm,
aspect is it shifts people's attention, and like the running people through their clinics or getting them in and out because it's a numbers game, or the pharmaceutical companies who have so much power at these,
yeah,
even the continuing education conferences where they're doing all of the sponsorships and paying for everything, why then the speakers and the presenters are all kind of funneled through by how they're going to tout the next drug or treatment.
right.
So this is yeah, the money. It really all boils down to where does the money come from?
Yeah, the
And
research, you need more money for research in this field. Pharmaceutical companies are not going to contribute that, obviously. So it has to come from government or private sources,
right.
more research. And pharmaceutical companies have created this concept of evidence-based medicine. Now, it sounds very scientific. It sounds, much more clear than non-evidence-based medicine. But the problem is a lot of that evidence just comes around pills. It's
Hmm.
not necessarily evidence of a psychological program or reading a book and listening to a video and what effect does that have on you. So we need more evidence in that area and
Hmm.
call that evidence-based medicine as well. We're trying to do that, but it's a slow process.
Right. It's great that there's so many more resources than there were when I was looking for the answers. But people I try to tell now, hey, read this book or listen to this video or watch, check this YouTube video out, and something to do with people that have healed, or looking at your website, for example. And more times than not, people roll their eyes and, oh, yeah, but that's not for me. That's not my answer. I was diagnosed with this or that. So I don't know. There's the work that you're doing is powerful. I want to make sure I mention that. It's just trying to get people to open up their eyes to the possibilities, that they don't need the drugs, or they don't need to be locked down to a lifetime of symptom treatment, symptom management.
Yeah, I
That's
mean,
what
if
I,
you're not responding to other things, keep open up your mind and look at this, right? I mean, if
right.
you get better from physical therapy, you don't need to see me. But
Mm-hmm.
if you're not getting better from a variety of treatments that you've tried, then it may not be that they're treating the right diagnosis or the right area of your body. The brain and the mind and the emotions are
Mm-hmm.
often ignored. So be
Huge.
open to that. The work involves some effort on the patient's part. You had to go to therapy a little bit and do some journaling, read some books, but it's not incredibly awful. It's not
Mm-hmm.
incredibly hard, and it's so meaningful, and it can really change your life as it seems to have helped you so much and
All
your
right.
family.
Some people can recover really quickly. It's just a matter of, again, that belief that um, the power of your mind, if you adopt it and accept it, some people can accept it and they're healed in a matter of days. Some people, it takes them a minute because they got to go through it, start, stop, and kind of change their thinking around it, stop focusing on it. That's the biggest thing for me, is stop focusing on the pain. Because if you stop focusing on the pain and you start thinking about what's going on emotionally, then the pain just doesn't have a reason to exist anymore.
Right,
It just
exactly.
starts to evaporate. And then I woke up one day, I was just walking around the mall. It was a nice, beautiful, sunny day, and I just thought to myself, wait a minute, I'm not hurting. Nothing hurts. Where's the pain? It's gone. And it was just like, it wasn't like a light switch. It was a slow process that just came to me, and it was just a realization more than anything that I had defeated it and it was gone. I want to ask you lastly,
Yeah.
what are some of the most powerful examples, people you've worked with and have healed from seeing you, whether they be real severe cases of chronic pain or rare situations that people haven't heard of? Can you can you share with some stories?
Well, there's been so many. They kind of blend a little bit. I mean, I
Yeah.
mentioned this fellow who had 20 years of pain, never ran before, ran with his son. I mean, that was a powerful story that has stuck with me. Obviously, your story has become perpetuated in your book, and so I can reread it and learn about how you got better. Uh, lots of different ways. I mean, people who people who hadn't I had a patient who hadn't worked in 10 years. They were in their 40s, hadn't worked for 10 years. I mean, that's kind of, you've lost a lot of your productive years
Mm-hmm.
and worked through this program and got back to doing film editing and having a productive life. And that was just so meaningful to them to not have to rely on others for support. They were able to make an income and have the usual life that people have had. There've been women who were afraid of getting pregnant. Women in their 30s, let's say, afraid of getting pregnant because my back is so bad. If I get pregnant, how bad is it going to be? And I would tell them, number one, it's not going to get worse. And number two, we're going to get you better. So when they got better, they've gotten pregnant and they've come back with a child a few years later. And they say to me, look, this child is because of this program, because you helped me. And I said, well, I didn't help you get the child. That was maybe your husband and your OBGYN. It wasn't me.
Yeah.
But they said, no, it was because I lost the fear. I lost
Yeah.
the fear of my back. And that's what made the difference. So
Well, yeah, you set the
that's
stage for things.
yeah, so that's very rewarding when people it's rewarding when people can change their lives and when this becomes meaningful to them. But just, relieving pain is very rewarding, and to do it without pills and shots. And I've also had people who are on opioids, narcotic medications for years, and they go into this program and they'll call me up and we'll talk, and they'll say that they don't need the pills anymore. I go, well, just get off it slowly, just so it doesn't
Mm-hmm.
become like a withdrawal thing. And
Mm-hmm.
sometimes they surprise me how quickly they can get off it once they realize they don't need it because the pain is going away.
Mm.
So you think, well, opioids, so hard to get off of, and it is for many people, but that's because they're still fearful and they still have the pain. When the pain goes away, it's actually pretty easy to get off of it.
Mm-hmm.
So that's been very rewarding when people have been able had a number of people been able to get off of long-term opioid use as a result of this program.
You've helped people with all sorts of conditions, right? Not just
All
back pain, but all kinds of different
all sorts
conditions.
of stuff. I mean, people. There was a doctor with headaches. Here's a good one. She was a doctor, maybe 40, couple of kids, very severe headaches. Her husband was a neurologist. She was a doctor, and her husband was a neurologist. Neurologists treat headaches, right?
Yeah.
So she goes through my program, and in a month, 6 weeks, she's like completely free of headaches, and she's getting off of all of her migraine medicines.
Mm.
So she calls me up and says, "I want to do this work too." And I told her how she might be able to incorporate this into her own work. And then I said to her, has this influenced your husband at all? And she said, "Well, he's amazed and happy that I'm completely better, but he can't internalize this into his mindset, into his view of the world. So he still keeps prescribing the migraine medicines and that kind of
Yeah.
stuff." And I just thought that was so interesting because she wanted to become a mind body doctor. The husband, who had seen the same thing that I saw and that she saw, he couldn't relate to it. He was happy
Mm.
that his wife was better, but he couldn't connect it. So I thought that was an interesting one.
Oh, yeah.
Um, I've
That's
treated some celebrities who thanked me, but they also don't want to talk about it as a celebrity endorser because this
yeah,
field could use more celebrity endorsers.
sure.
That seems to be something that helps Americans and other countries to sort of believe something, when they hear
Yeah.
it from a celebrity. So I've had a couple of people who have been willing to speak about it, and as I mentioned, Howard Stern and Larry David have spoken about it, but
Hmm.
from their work with Dr. Sarno. But it'd be great to have more people willing to speak about it who I've
Oh, and
helped.
there's
Yeah,
tons more. There's
yeah,
tons more. There
yeah.
was a
So
state senator, I think a U.S. based
yeah,
state
there was a
senator.
senator that Tom Harkin that Dr. Sarno had worked
Right.
with, and he died. But I mean, his daughter, I think, continues to do some of his foundation work and things. There have been other people that Dr. Sarno helped, but I mean, the A-list celebrities sometimes that you see in Los Angeles, and I don't see that many of them, but I've seen some of them. They kind of avoid. They want to come at the end of the day, and they don't want to talk about their personal life too much,
Hmm.
because they're afraid it's going to be written up in the tabloids and
Hmm.
twisted around and that kind of thing. But
Yeah.
anyway, that's a small subgroup. I mean, the vast majority of people I treat are ordinary folk with jobs and families, or stress, and they're just not processing the stress well, and it's starting to affect a part of their body, like headaches and pelvic pain and back pain and arm pain and foot pain and knee pain
Sure.
and nausea and some of my colleagues are working with long COVID, and they're finding they're getting great results with a mind body approach to long COVID. So that's an
Nice.
interesting
Nice. That's amazing.
interesting twist. A disease that, again, there's not really a lot of markers or anything for long COVID. People just claim they had COVID, and they got worse. I treated people who had the COVID shot and believed that the COVID shot made them sick. Now, I don't disbelieve people with their symptoms, but I say to them, is it possible that this could actually be just like your nervous system overreacting and, fear and worry? And there's a lot of stuff written about the vaccine and the disease and all that. And I've gotten people completely better
Hmm.
who were like debilitated from what they thought
Oh
was a
yeah.
vaccine reaction.
Yeah.
And
I've
maybe it
seen.
was initially, but at the time that I saw them, it seemed like there was a lot more emotional stuff going on that we could deal with. And they were open to looking at it that way. So that's another condition. I had an email recently from somebody who said that they were psychologists, and they were treating somebody who had thought that all of her symptoms were from stopping the birth control pill 5 years ago. So I said, "Well, what are the symptoms?" She said, "Arm pain." I
Hmm.
said, "Number one, changing your hormones 5 years ago shouldn't affect anything that you're doing now, because your body's had plenty of chance to equilibrate to the getting off of that birth control pill 5 years. Secondly, it's arm pain. Why is that the symptom from birth control, the cessation?"
Right.
So I said it's got to be TMS, and so they found that interesting. People have all kinds of odd symptoms. I mean, people who have pain only between 4 and 8 p.m. every day.
Yeah.
They don't have it at night. They don't have it at daytime. They can exercise. They don't have, but they have it between 4 and 8 p.m. That's not physiologic, that's psychologic, right? I mean, so that has to be worked on to understand what that 4 to 8 period means. Maybe it has something to do with childhood. Maybe it has something to do with a job you had, or going home to meet your spouse. I try to help them analyze what it is, and if appropriate, have them see a psychologist. So there's lots of
Yeah.
interesting stories, lots of interesting people. I've treated thousands now, and
Well, they have new diseases coming along almost every year. There's a new set of diseases. Like, have you
mm,
seen people with the Lyme disease? That's kind of a new hot
yeah. So
trend.
There are people with legitimate Lyme disease, both with the rash initially that should take antibiotics and also with certain markers that are very severe later on. But there's also people who've convinced themselves that one or two markers show up positive, which is not enough to diagnose Lyme disease, but they've had Lyme disease for 5 years. And again, the experts say they don't really have Lyme disease, but they're convinced they have it. Or some experts say it, or some quasi experts say it, and we work on the mind body and they get better.
Hmm.
So there's definitely people with real Lyme disease, but there's also people who have convinced themselves that they have that.
And don't.
As you say, there's almost like a medical fad every 10 years. Sarno pointed out that peptic ulcers were very common as a mind body symptom in the 50s, but then they became, or the 60s, but then they became less acceptable in the 70s to say you have a peptic ulcer. Was less acceptable, and so that became less of a psychophysiologic symptom.
Yeah.
We don't hear
Yeah.
that very
No,
much
you
anymore.
don't. It's
You
not
don't hear
even a
peptic
common.
ulcer very much. Right? When was the last time you heard somebody say I have a peptic ulcer? People get a little heartburn, reflux, but they don't really talk about peptic ulcers anymore.
Yeah.
So that was a fad. Chronic fatigue syndrome is another
Yeah.
one where people sometimes are debilitated, and occasionally there's a medical reason, and a lot of times it's a mind body condition.
I
So
was going to say that's one thing. Heather works with a lot of women,
yeah,
and they're most are diagnosed with that. They have, depression, anxiety, chronic fatigue a lot of times, and then a lot of the typical pain sufferers with the chronic back or knee or hip or headaches, multiple things like that. But the chronic fatigue, a lot of women are attributing that to the breast implants, and I'm not sure.
yeah.
Heather says, that's just the going fad of right
Right,
now. You
right.
guys are
Another
looking for
fat. I
something.
mean, when you have multiple symptoms, it's more likely to be a stress-related thing. When you had one symptom in your 20s and another symptom in your 30s and another symptom in your 40s, kind of moving around, that's also often a psychophysiologic thing. So I'm not in any way minimizing people's discomfort. I mean, whatever you're suffering from, I definitely have sympathy and empathy for you. I'm just saying that you may want to look at it a different way because this treatment approach is not dangerous. It's not injections. It's not
Mm-hmm.
ultra expensive.
Mm-hmm.
It can save you money if you're going to get a lot of procedures and expensive medications and other things. Sometimes this approach can be very effective and cost effective. And there's been people cured by books, mine and others, and there's also people cured with one visit, or sometimes they need to come back multiple times and also work with a therapist. But um, the fact is, vast majority of people we've studied and reviewed and seen get better, and that's pretty good for
No,
something that involves talking and reading and thinking and attitude and belief, and no long needles or surgicals.
it's just getting to that point where they're willing to try this or willing to walk away from maybe some of their traditional beliefs and try a different path because it was the cure for me. It was the answer for me. I suffered needlessly. I will I will say the suffering was helpful in now my mindset and how I look at the world and how I help my family see things and how I try to help others. And I'm so grateful again for you and your work, the people that you work with, and the I guess growing numbers of people that are understanding this and putting it out there for the world. And the world now needs to just find a way to grasp on. Looking for science, they're looking for all the studies, and they're facing roadblocks a lot of times because you know traditional medicine or pharmaceutical companies will bash this and they won't give it the time of day. But it is, in my opinion, the answer to nearly every condition that's out there that you're having trouble curing or healing from. So, Dr. Schechter, thank you so much for being on our show today. All the information about how to get a hold of you is going to be in the show notes. So, folks, I hope you enjoyed this show. I know this is valuable information. I know there's people out there who are going to benefit from this. Share it with all the people that you know who may be suffering or have a condition that they're just not sure what's going on. Thanks for being here, Dr.
Yeah,
Schechter.
you're very welcome. I enjoyed it. I enjoyed the discussion, and I hope this helps some people out there.
100%. I'll send you a photo of that horse, okay?
Yeah, you got to get a picture of the horse. That's a must.
It's coming.
All right.
All right. Thank you so much. Have a good
All right.
day.
You too.
Thank you for listening. For more information about today's show, please check out the show notes. Visit our website at www.petersonws.com or give us a call at 801-475-4002. Peterson Wealth Services is a registered investment advisor. This is a paid-for advertisement. Information presented on this program is believed to be factual and up-to-date, but we do not guarantee its accuracy, and it should not be regarded as a complete analysis of the subjects discussed. Discussions and answers to questions do not involve the rendering of a personalized investment advice, but are limited to the dissemination of general information. A professional advisor should be consulted before implementing any of the options presented. Peterson Wealth Services.